Tonight we're going to try and find out why some people do snore so badly. Robyn Fowler is here from Sleep Clinic Services. She's been a sleep therapist for around about 6 years. Hello, Robyn.
Hello.
Just anecdotally, around the ABC office today discussing snoring, it feels like this is something that affects every single person I spoke to.
Yes, it wouldn't surprise me at all. 1 in 3 of us do suffer from some sleep disorder breathing problems. So if you're not one yourself, I'm sure you really do know somebody close to you that does.
What's the worst snoring sound you've ever heard?
Snoring where it just continues on and then it stops. Just stops and there's no breathing. And then all of a sudden, just a big gasp and a choking sensation. And people can do this hundreds of times during the night.
Yes.
They can say to me that they've slept 10 hours and yet they wake up feeling like they haven't slept at all. Mm-hmm. So it's I'm starting to feel a bit like a marriage counsellor. My mission is trying to get people back into the same bedroom together.
Yes, because this is the thing. I was speaking to a young guy who's just about to get married, so still in his 20s. He and his partner are already sleeping in separate beds because of snoring.
Yeah.
So the pressure on relationships is huge.
It is. It does impact on so many areas of your life, and definitely with the partner. If the partner's not getting the same quality of sleep and constantly nudging the ribs for you to roll over, you're not going to get the sleep either. So neither does the patient, neither does the partner, and this is where it impacts greatly on so many aspects of their life. You know, we get irritable and cranky when we're tired. We don't mean to say the things that we do, but we do get a bit snappy. It has a serious impact on the health and also on work safety issues as well.
What is actually making the sound, that sort of snoring sound?
Yes, so when we go off to sleep, our outside body muscle tone starts to relax, as does the inside. So effectively what happens is that the tongue, the soft palate, the uvula, the little thing that hangs down the back, and the pharyngeal walls, they all get relaxed as well. And what happens is they start to slide back into the airway. So now your airway is compromised. It's much more narrow. So every time you inhale and exhale, your breath is vibrating over the back of the throat, the uvular area, and this is where we start to hear the sound of snoring, which is a clear indication straight off the bat that there is an impaired airway.
An impaired airway, yes, because I'm just trying to think at what point it becomes a disorder as such, because the relaxation makes sense, but at what point does it become a problem?
Snoring in itself is the problem. And then
So we shouldn't snore?
No, there's no reason why we should be snoring. If I was to be walking down the street and you're walking towards me and you see me fully awake and snoring, would you not think that was a bit strange and think, gosh, she needs to get that checked out? So why is it natural when we're in an unconscious state and we don't have any control over it? It's not natural. I think our problem is that we're being conditioned from childhood to hear mum or dad or grandparents snoring and we just think it's normal. That's what older people do. But we don't need to be.
Robyn Fowler is my guest. She is a sleep therapist from Sleep Clinic Services, discussing snoring tonight, and I'd love to hear from you if it's an issue in your life. 1300 222 612. Love to hear you describe the problem snoring in your world and any tips, anything that you've found that helps the situation. You can also send me a text, 0467 922 612. Someone has texted in saying, Beck, my ex-wife informed me that men snore but women only purr. Yeah, I think based on some of the snoring that I've found on the net today, we can say that men and women snore equally loudly.
We certainly do.
Robyn, you said 1 in 3 people snore. What are the factors that exacerbate snoring?
Age is one, weight is another, and throat structure is another one. So what I have found is that sleep disorder breathing conditions don't discriminate. It's gone are the days of the 60-plus obese gentlemen that we would typically think. I've got many patients who are in their mid-20s of both genders who are severe apneics, and they're not old or they're the right weight for their height, so they've unfortunately inherited mum or dad or grandparents' throat structure, so they're already predisposed to it, and it certainly has a severe impact on so many health areas. in their life.
What about things like fatigue and whether or not you've had alcohol? Because they seem to be the other factors that people comment on.
Yes, obviously being tired, yeah, definitely. And that's usually because you may be not having as much oxygen throughout your night as you should be, which can cause some significant health issues. Alcohol, yes, or even medications, that's fine. But a lot of people need to be on medications, for example, and there's nothing wrong with having, if you enjoy a couple of drinks of wine during your night or a few beers, that's fine. It will relax you. But still, even, people that don't drink or take medications still have the same problem. It's all about the relaxation of the body when you're going to sleep and what's happening on the inside as well. The outside relaxes, so does the inside.
Sometimes people can wake themselves up
Yes.
with their own snoring.
That's
That's not necessarily helpful though, is it?
No, not really. We shouldn't be snoring at all. So that's usually a frightening thing for a person to actually wake up with that choking or gasping sensation and they think, oh, God, what happened? And they realise that they're in their bedroom and, okay, well, I'll just go back off to sleep again. But yes, it definitely can be very frightening, and the more this happens, just the worse it gets. It doesn't improve with age, it only gets worse.
We talked about the pressure on relationships too for the person who perhaps doesn't snore, but what about for the snorer themselves? Do you find that people sometimes suffer guilt?
Yes, it's quite a few times, just in the last week I've had patients ring me and say, look, it's causing all sorts of issues with my wife. She can't get any sleep because of me. What am I going to do? It's just really seriously. It's not bothering me. She tells me I snore, but it's bothering her. So it's, this is where the whole problem comes with that relationship issue. And this is where it impacts there. And then it flows through to even your working environment. You may not be as productive as you should or could be, and then therefore that impacts also on the partner's working day as well.
Yeah, so it starts to become a pretty serious problem. Robyn Fowler is my guest, a sleep therapist. Love to hear from you tonight if snoring is an issue in your family or in your relationship. Tell me a snoring story tonight, 1300 222 612. All right, let's talk about some strategies to manage snoring, Robyn. What would you say is the first step for people?
Yes, the first step is to have a diagnostic sleep study. Now, we can do that anywhere in Australia. That's no problem. We need to get the diagnosis to find out the severity and the duration of apnea present. An apnea is not an apnea until the cessation of breathing is 10 seconds or longer. And I frequently see patients that are stopping breathing for 2 minutes or longer. No awareness of it. They say to me all the time, I couldn't hold my breath that long. And it's true. In a conscious state, you would find that difficult to do. But unconscious, it's no problem at all.
Just taking a step back before that though, can you snore and not suffer from sleep apnea?
You can be a silent apneic, but or it's a case of you could be breathing just a bit, maybe a little louder than normal, and then you'll stop, and then you'll start to breathe again, and then you'll stop. And so this situation just goes on all night. So yes, you can. It tends to be a lot more rare though.
Okay, so once you have that, you get an understanding of your own sleep and breathing pattern. What are some basic tips on helping people either have better control over their breathing and therefore better sleeping?
Well, usually trying to keep the regular routine. For starters, so trying to go to bed at a similar time at night time, probably not drinking coffee and that's the caffeine drinks too late into the night. Personally, a lot of people say don't read, but I love reading before I go to bed. It actually helps to relax me and go to sleep. But just normal sort of sleep hygiene, just trying to keep the room at a good temperature for yourself and going to bed at a normal time, trying not to, be all over the shop. So getting that rhythm better for you.
So once you have sort of some good habits established there, if very loud and broken sleep snoring is still an issue, what do you escalate to in terms of treatment? In
terms of treatment, yes. Unfortunately, there is so many people now that we're seeing that are moderate to severe apneics. And when I say severe apneics, I'm talking about people who stop breathing for more than 30 times every hour, and the minimum is 10 seconds. So you're doing that all the time throughout the night. Some people are actually pretty much arousing where they wake briefly, take a breath, not even aware of it, go straight back to sleep. So it just escalates as the night goes by, and also just in their waking hours, so they're just finding it's just too hard to function. So once we have established what the diagnosis is, then we look at the findings and the recommendations put forth by a sleep physician, and then we implement those recommendations and discuss the appropriate treatment options on the outcome of those results for those patients.
And does that usually mean some kind of a machine that's attached to people?
The gold standard of treatment still in the current world's technology is CPAP, which is continuous positive airway pressurisation. You can't snore when you're on that because it acts as a splint to keep the airway open.
So is it a mask that you wear?
Yep, you have a mask. They're not as horrible as they used to be. The technology has improved dramatically, where a CPAP machine, you shouldn't even be able to hear it in the bedroom. And the masks are very, very soft silicone. We can have one that just fits into the nostrils, a small one that just fits over the nose, or for people who really just can't breathe in and out through their nose, we can have a full face one. Try very hard to keep them off that if possible, but for asthmatics especially that just can't keep their mouth closed, it's fine. And we do a lot of patient care to make sure that the patient is really comfortable and understanding of what they need to do. If a person is requiring CPAP for whether it be workplace issues, occupational health and safety, or for drivers, it is a notifiable condition, so it can cause havoc on the roads.
Is it the sort of thing that you have to wear for the rest of your life then, or do your airways kind of train or get stronger?
No, it really is long-term treatment. Some people will lose weight and their snoring may, calm down. I don't know whether it'll actually completely go away because, once again, if you're not using it, then you've got nothing to hold your airway open. So you will do what comes naturally in an unconscious situation, which is you'll have your tongue, soft palate, uvular and pharyngeal walls collapse back into the airway. So I don't think it's such a big deal now. If you're lying next to somebody snoring and keeping you awake, I don't think you'll have a problem with them lying there quietly and peacefully and sleeping beautifully, as so that you can too.
Yes, and just finally, Robyn, you said at your sleep clinic you're seeing more and more people with more severe sleep problems. Why do you think that is?
Well, a lot of my patients are shift workers for starters, so they work crazy hours, absolutely. And
so they're exhausted to begin with, and then it becomes this kind of cycle.
Well, interestingly enough, a lot of them don't even feel symptomatic. They've been so used to being like this for so long until they actually get treatment. Then they, it's amazing. They think, oh God, I must have been feeling crappy because now I feel amazing. But at least what we can offer is the service right around Australia and in the regional areas where a patient doesn't have to drive when they're tired, many hours of distance to get to a big clinic or hospital situation, or indeed spend a lot of money to fly to a nearest capital city to get some treatment. So at least now with technology, we can provide that in-home straight to the patient's door.
Robyn, appreciate your advice tonight. Thanks so much.
My pleasure.